And thanks for staying with us. And now we're staying on our coverage of the coronavirus pandemic. As COVID-19 cases soar in Africa, concerns have been raised about the continent becoming the epicenter of the pandemic at a time where hunger is rising and doctors fear a resurgence of deaths from malaria. Now, that's why the World Health Organization has asked countries to be proactive in the distribution of prevention and treatment tools at this stage of the coronavirus outbreak. It also wants them to do their best to safely maintain these essential malaria control services. Habeedah Lawal reports.
To date, the number of reported cases of coronavirus in sub-Saharan Africa has represented only a small proportion of the global total. But cases are now increasing on a weekly basis. This means that countries across the region have a critical window of opportunity to minimize disruptions in malaria prevention and treatment and save lives at this stage of the coronavirus outbreak. Sub-Saharan Africa accounts for 94% of all malaria deaths, and the victims are usually younger than 5. If prevention services such as the distribution of mosquito nets decline during the pandemic, the number of casualties this year could double. Here in Nigeria, health experts believe that much more should be done in terms of awareness to stem the spread of malaria.
Entirely true, because look at it, malaria every year kills over 500,000 people. These are the information that every year, every 12 months, a minimum of that must die. And in Nigeria, a minimum of 180 million people must have malaria once or twice. And when we realistically look at it, we see that none of us will ever suffer from malaria anything less than twice in a year. If we take that statistics as it is, means that 22 or 200 million Nigerians suffering malaria twice in a year.
It's over 80%. Most of the cases that come in here, we send it for MP, and whether it comes out MP positive. I think it's because of the environment, because people around here they live in a communal environment, in the sense that they are always together and the surroundings are not too clean, and it helps to breed this female mosquito that causes malaria. So when they are bitten, they tend to come back with malaria.
Although World Health Organization admits a similarity between symptoms of malaria and coronavirus, they identify that both are deadly to human existence. A shift in effort away from malaria control is believed to fuel another fatal outbreak. Habeedah Lawal, TVC News, Abuja.